On Friday the 10th of November 2017, 3 people were admitted to hospital with serious food poisoning, incorrectly assumed to be botulism. On Monday the 20th of November, TV Wild submitted an Official Information Act request to the Waikato District Health Board, asking for all the results of tests undertaken on patients and food samples. On the 28th of November, 18 days after the family were admitted, urine samples were received by Landcare Research for testing for 1080 poison residues.
To start things off with, I just want to put it out there that when I make reference to the DHB, I do not mean to include any of the doctors or nurses that were involved in Shibu's care. We have the utmost regard and respect for the professionalism and the care that was demonstrated with Shibu and family. So Shibu puts in a written request to the DHB asking to see what is on his medical records, himself and his family's. We were told, or he was told by the DHB, that his written request, that's all well and good, but we need you to fill in our own request forms and also provide proof of identity. To that extent, they emailed him request forms to fill out. Now, Shibu is stuck at home. He does not have a printer or a scanner. He is medically unfit to drive, has no clearance to drive. So the poor soul had to rely on us again. We got these printouts from Hamilton, drove all the way to Putaru, got their signatures, collected proof of identity and passed it on to made an official request again to the DHB. We got a response stating that it would take up to 20 working days, which is a full month before any information is provided. Once again, it begs the question, why does it take 20 working days to provide information that's already there at your disposal? So it was a classic case of going from the frying pan to the fire. So on the 20th of Wednesday, 20th of December, which is the Wednesday, Shibu made his first written request. On Thursday, the 21st, DHB responded back by saying, no, fill in our own request forms. On Thursday, the 21st is when the first part of this video was released. On Friday, the 22nd, we are told that they made a statement to the media that said it is negative for botulism and also that 1080 has been tested for. We were not informed at any stage that 1080 was tested for. Shibu got to know about this on Friday afternoon. I heard about this from the media. Shibu was not even informed or asked whether these statements be released to the media. He himself was trying to get a hold of his medical records and being told to wait a month before he can have access to it. So he was not brought into the picture before a media release was made. Also on Friday the 22nd, Shibu was visited by members from the public health services, namely Dr. Richard. Shibu asked him as to whether 1080 testing was done and also told him that verbal confirmation is just not good enough, so he would like written confirmation about it. On the afternoon of the Friday, Shibu was sent an email with a test report for 1080. Now the test report for 1080, it's as comical as it can get because the date on which it was tested was the 28th of November. Shibu was hospitalized on the 10th of November. So they actually tested for this poison 18 days after he was hospitalized, which to me seems absolutely strange. So what puzzles me is, what is the DHB trying to say? That they had 3 people struggling for their lives. They do not have a clue as to what was wrong with them. But yet they waited for 18 days, watching these 3 thrash around on the beds. They waited to see if it would just go away. And 18 days later, they decide to test for 1080. It raises a few questions, doesn't it? Is there any validity in testing after 18 days?
In this research paper by toxicologist Charles Eason and Mark Wickstrom, it is stated that the earliest reports on rats suggested that some 1080 is retained for 1 to 4 days, and the highest concentrations occurred in blood, with moderate levels in muscle and kidneys. All traces of the toxin are therefore likely to be eliminated within 1 week. And the paper goes on to say, when talking about risks to operators, it has in the past been mistakenly assumed that rapidly eliminated poisons only have short-term effects. This is a misunderstanding of the basic principles of toxicology, confusing rates of metabolism or excretion with the lack or presence of toxic effects. The manufacturer's warning label states that 1080 poison may be present for many months in the carcasses of poisoned animals, thus presenting a secondary poisoning danger to carnivorous and omnivorous birds and mammals.
Secondly, I know that the doctors were in communication with the CDC in the United States, right? Would that be easier, or would it be easier to test for a commonly used poison right in your own backyard?
Around 2 million kilograms of 1080 poison bait is spread by helicopters across New Zealand's forests and waterways every year. Enough poison to kill over 60 million people every year. The factory that imports 1080 poison and manufactures the baits is a state-owned enterprise. The two acting shareholders are the Minister of Finance and the Minister of Primary Industries. Its warning label states that a lethal dose of bait for an adult human could be as little as 30 grams. That's equivalent to just 2.5 of these 12-gram baits. Animals like deer and pigs can consume many more baits than is required to kill them, making their dead bodies massive toxic baits for any bird, animal or person that eats them. The latency period, which is how long it takes the victim to feel the effects of the poison, can be as long as 29 hours, meaning a live animal could be harvested for food while containing a fatal dose of poison. On the website ToxNet, it states that the symptoms of 1080 poisoning include vomiting, apprehension, loss of consciousness, metabolic acidosis, and clonic-tonic convulsions. On the day that the family were admitted to Waikato Hospital, Subi was observed displaying symptoms inconsistent with botulism poisoning.
I did come to know about that during the doctor's meeting, that Subi did go through seizures, and that was part of the reason why she was moved from acute to intensive care.
After receiving some of the hospital medical reports, lawyer for the family Sue Gray stated, "The medical records that have been disclosed make it clear the doctors at Waikato Hospital were aware within days that botulism could not be the cause of the dramatic family illness. The timing was wrong, the symptoms were wrong, and the test results showed that the cause was not botulism." The hospital tested for other possible causes, but the DHB continued to tell the media that the cause was most likely botulism.
But what also concerns me is that the DHB lied to the common public. Because when they stated that 1080 had come back negative, they did not put out the entire truth. What they should have said is it was tested 18 days later. It was tested 18 days after hospitalization, and hence the reason why it's come back negative. So I think they put out partial information, and that is tantamount to lying to the general public. This is a bit like saying that a drunk driver was arrested and he was tested for alcohol 18 days later. What do you expect to find? And then a press release was made stating that we've tested him for alcohol and nothing was found.
On Friday the 22nd of December, the day after the first video interview was released by TV Wild, Dr. Richard Vipond and his team re-interviewed Shibu at his home in Putaruru. Dr. Vipond insisted to Shibu that 1080 poison was not the cause, but continued to pursue the source of the wild pork that the family had consumed.
Well, for starters, I do not know where he sourced his information from, because he's interviewed Shibu twice, and in both his interviews, Shibu has categorically stated that the only thing they have consumed that the children have not is that wild boar. I don't know how much more simpler it can get from there. I think there was a lot of emphasis he put on the fact that it's not 1080, and they have nothing to back it up, and the only thing that they came back with was this test result that is 18 days late, which is inadmissible, honestly. But it is the attempt at trying to hoodwink Shibu that is deplorable here. when we started down this track, like I said, all we wanted to know is what's taking the ACC so long that they need 3 months, right? So we said, let's have a look at the medical records at the DHB. Now, it is the hesitation from the part of the DHB to readily produce those medical records. To top it, the attempt by the public health service to try and hoodwink Shibu with that bogus test result. The fact that the DHB has released statements to the media which are only partially accurate. All of these things, it really casts a big doubt. I mean, it reeks of a cover-up.
The manufacturer's warning label states, "Take measures to minimise the chance of baits accidentally entering any body of water and harmful to aquatic organisms." However, no attempt is made to avoid waterways. The official toxin distribution charts show that almost all of the forest streams are poisoned at the same rate as the land areas around them. Poisoned animal carcasses are left to decompose where they fall, be that on land or in water, despite the manufacturer's warning label stating that they are ecotoxic and that the exposed bodies of all poisoned animals should be collected and buried at a landfill approved for hazardous wastes. In October 2016, a medical officer of health for the Waikato District Health Board responded to a request made by regional councillors Kathy White and Clyde Graf for additional warnings to be added to public notifications and signage. In his response, the officer pointed out that the DHB's role is to protect the health of the public from any risk associated with 1080. After stating that the request falls outside of the DHB's responsibility, the medical officer of health went on to say, "I do understand your belief that people have a right to know that 1080 may have been dropped into waterways, regardless of whether there is a health risk or not." However, he also stated, "In fact, including your proposed wording on notifications could cause unnecessary anxiety to people." In August 2016, councillors Kathy White and Clyde Graf had their recommendation passed at Waikato Regional Council. The councillors felt that it was important for the public to know that poisoned bait is dropped directly into forest streams and that poisoned animal carcasses may be present in waterways, regardless of whether it caused anxiety to people to be better informed. The following words would now be added to the council's warning signs. Poisoned baits or carcasses may be present in waterways.
1080, for starters, 1080 is not tested on humans, right? So if it is 1080, then we do not know, or Shibu does not know what he is in store for, say, 10 years down the line. What lasting effects can that leave? So it's absolutely important that this medical records are accurate. Should it come to that and ACC, and we have to apply again for ACC, it's important to know where it came from. Now, if it's not 1080, well and good, fine, just tell us what it is. At least we will have it on record that such and such poison or poisoning has occurred. And it's hard to be prepared for dire consequences several years down the line, but at least the family has a better chance of support should things turn ugly later on. The interesting part here is the ACC, the DHB, and the Public Health Services. These are all funded by taxes and levies that the common man pays out. We are not begging or pleading for a service. As tax-paying residents, we are demanding proper service from this organization that is very prompt in collecting payments for their service. And I do hope, I do want them to move faster than they're doing now. Now, since this video has been released, we have been approached by just random people in supermarkets and other places, and general public-based places. And some of them are from rural areas, and they've said it's been many years since they've purchased meat from the supermarket. It's, I understand, it's a part of keeping lifestyle to hunt and have game meat. And there is such a very real concern out there as to what really happened to the family. I mean, we need answers as to what actually went wrong. Okay, if people claim that it did not come from the meat, fine, prove it. Where are the tests on the meat samples? If it is the meat samples, then what was in it? So it's not just us now that are looking for answers. This is actually become something of real big public interest. But if we rewind this timeline again, 3 people were taken by ambulance to the Tokoroa DHB. Now, many hours later, but on the same day, when their situation continued to deteriorate, they were moved once again by ambulance to the Hamilton Hospital, no, the Waikato DHB. Now, just out of common sense, if you have 3 people in the Tokoroa DHB that are vomiting, throwing up, what would be the first place you would look for contamination? You would definitely take blood samples. You would definitely take samples of the vomit. I mean, it does not. This is just basic common sense stuff, right? And we know for a fact, because of a statement from Shibu's neighbor, who was present when the public health services turned up at Shibu's door in that first week of hospitalization. He was actually present along with them in Shibu's house as they were taking meat samples or removing samples of meat, fish, pickle, all the other stuff at home. Where are the test results for these? That's what we want to know. Not a bogus urine test sample that was sent away 18 days late. No, it's the test results from these initial samples. Where did that disappear to? Where's the test result around it? That is what we want. This whole sequence of events leading up to our issues with the DHB, all of it was triggered by an offhand comment by a member of or a representative of the ACC. Now, he made a comment stating that if it was not proven to be botulism, then a decision would be taken by the ACC based on the nature of treatment given. And we knew at that point of time that the only treatment that was offered in this case has been, I believe, one administration of anti-botulism or botulin medication. So we thought, no, that just doesn't sit right. And when Shibu woke up, he was just happy to be given a second chance at life, happy to have another go with his children and his family. He wasn't too concerned about what got him into this mess in the first place or what hospitalized him in the first place. But after this response from ACC, we were keen to know what the truth was. Following, we made the correct applications for ACC, and we received a response from ACC stating that they are waiting for notes from the DHB or medical records from the DHB, and they will have an answer no later than the 15th of March 2018, which is a full 3 months after the application for ACC is made. And we were puzzled. Now, one, why is there such a hesitation from DHB? I mean, this is not the 1800s where you need a messenger on a horse carries documents from one place to another. It's just the push of a button, and the DHB has basically offered ACC the required documentation. And what could be in this documentation that needs 3 months of study and perusal before a decision can be made? So sick and fed up with one organization, we turn for a bit of reprieve to another organization, the DHB, because we've asked politely and we've been pushed around. We have sought legal help, and we're very thankful to Sue Gray, who stepped up, and she'll be representing Shibu henceforth.
Please consider helping this family. If there is no decisive decision on what caused this awful event, they may be faced with a 6-figure healthcare bill. To help out, please visit the website below. Extensive independent information about 1080 poison use in New Zealand can be found on the 1080science.co.nz website, and an extensive presentation of film footage of aerial poison operations and documentation can be found on tv-wild.com.